Well, I'm really delighted that throughout the CQC report there's many references to just what fantastic care our staff have continued to deliver under the most challenging of circumstances. And they describe that care as compassionate and always taking into account the needs and wants of our patients and their loved ones. So that is tremendous, but I'm also obviously really pleased about the improvements that have been made. We've retained our outstanding for care, and we've made improvements to now be good for well led, good for effective, and not surprisingly requires improvement for responsive and safe. Well, we've been talking very openly for a long time about the pressures in urgent and emergency care, and we've been working with regulators to try and address those challenges. Conditions is very serious, and we share those concerns, but what it continues to do is keep a real focus on the efforts not only that we need to make within the hospital, but as part of that broader system. Now, undoubtedly, there's been a lot of progress made, but the impact, the positive impact of those improvements have not been felt in full, partly because of the ongoing nature of the pandemic, and we know about the real challenges we've got with workforce right across the health and care sector. So they are very serious, undoubtedly, and we would share that concern, but now it's about collective efforts within the hospital, within the department, across health and care, to make some sustainable changes. Well, we'll continue to do what we've always been doing, which is really share openly with regulators about the work that we've been doing. We'll continue to really engage our expert staff and our patients about what really matters, and keep a real eye on the goal. And the goal is to make sure that patients who are in need, especially those who are at home waiting for an ambulance that they can't get because they're outside the hospital, that we address those and improve on that time for triage and support for patients. So we're going to do that within the Trust, but most importantly, we're part of the bigger system, and we need to work with our partners, building on the great initiatives and good working relationships that we've got, to change the model of care, to support the new strategies, to make sure that we get ourselves, and importantly for our patients and staff, a sustainable model of care that actually can deliver in the timely way that we all want for our patients. I would want them to be really proud of the staff that we've got here for the compassionate care that they provide in what everybody would recognise as being the most sustained and challenging time for the NHS. But I would also want to absolutely reassure them that the work is not yet done. We still have a lot more to do, and are very committed to doing that, as all of our staff are, and our wider system, to make sure that they get the right care at the right time, at the right place, and in a timely way. And that requires a collective effort. And that effort is also about how patients can help us as well. And as always, I wouldn't want to miss an opportunity to encourage people to get their vaccine, even if you haven't yet had your first vaccine. It's really important. The staff are there to support you, to discuss this with you, and to help you continue to wear a mask and continue to manage the social distance that we've got with each other when we're not wearing masks. That's really important, and I think the people of Plymouth and wider have been tremendous in trying to help us as we are there for them. My message to staff would be, absolutely be proud of everything that you've achieved when you look back under the most challenging of circumstances. And in the CQC report, it does say that everyone they spoke to speaks of how very proud they are of their colleagues for the efforts that they've made, which have been simply breathtaking over the last couple of years. So be proud, see how far we've come, and know that we've got a really fantastic platform on which to build, and onwards and upwards.